Good afternoon, everyone. I'm Michelle Sanders from 314E. I'm going to be your moderator for today's call. I would like to welcome you all to the Bootcamp on Design and Build a Modern Healthcare Data Warehouse. This is an effort by our very own data expert, Dr. Siv, to help you in your healthcare data journey. Dr. Siv is the Chief Product and Analytics Officer at 314E Corporation and comes with Fortune 50 leadership experience in health IT and analytics. Dr. Siv, over to you.
Thank you, Michelle. Welcome, everyone. This boot camp, I'm just going to share my screen first. Okay. So we're going to be talking about warehousing of healthcare data in this boot camp. And we got the idea for doing this boot camp because as a company, we have been in the health IT space since 2004, doing system implementations, health IT services, database, warehousing, as well as EMR implementations. And over the last 3 years or so, we've made our foray into the product realm with products for data archival, health data analytics, and interface engines. And we've got service offerings around the whole area of analytics and EHR implementation. And that's where we got the idea to do such a boot camp, because when we've been working with several clients of ours in the healthcare data warehousing realm, we felt that the work we've done for them might be useful learning for others who are wanting to go down the same path. This is our profile, 314E. We've got nationwide customers, including academic medical centers, a lot of government institutions, both providers as well as health plan clients. And we've got a ton of industry affiliations and technology partnerships, including those with database and warehouse companies like Snowflake and Databricks. So this is the course outline. This is over 2 days. I won't read all of this, but approximately half of that will be covered today. And I'm going to be covering everything in high-level detail, not necessarily going into the weeds, because obviously we are constrained by time. But at the end of this course or boot camp, I expect that all of the participants will have a much better idea of how to go about implementing a healthcare data warehouse at your organization. And I'm expecting some of these teachings and learnings for you to be healthcare specific, while others are generally applicable to all data warehouses, even those outside of the healthcare realm. But again, the focus is going to be on healthcare data and how to effectively set up a health data platform that serves the business needs of the organization. So when we dive in, the first question that always comes up is, why is healthcare data warehousing necessary, right? Because many organizations in healthcare are still doing fine without any sort of online analytic processing or warehousing platform, because they're able to get by, at least for the time being, by querying their OLTP or online transaction processing systems, their production systems, whether they are EMRs or claim systems, directly, and they don't really have a centralized platform where they land all their data and serve up analytics and reports and insights from. Now, the reason why an organization looks to implement a health data warehouse are many, but these are the three main ones. That at some point, the organization finds that multiple healthcare use cases are not going to be satisfied by data from disparate OLTP systems, right? So if you have an EMR system and a CRM system and an ERP system, and you've got ancillary systems of various healthcare and non-healthcare types in your healthcare organization, at some point you find that to make analytics and reporting and other use cases easier, you need to integrate data from multiple of those OLTP systems into a warehouse type platform. The second is obviously that when you are talking about multiple systems, you have to integrate data from them into one place. And the best place to do so is in some sort of data platform or warehouse. And lastly, there's a huge number of business use cases in healthcare, which pretty much cannot be addressed if you've got data silos. So if you've got your ERP systems data very separate and siloed off from your EMR systems data, which is siloed off from your revenue cycle system data, you're never going to be able to generate the insights and the analytics that will serve the business use cases that your organization needs to address. And so those are the three big reasons why an organization finally decides to go in and build a healthcare data warehouse. When you look at the unique challenges in warehousing healthcare data, as opposed to, let's say, the finance or the retail or the defense vertical, these are the unique challenges that you will face as a healthcare organization. That, the sheer number of healthcare systems as well as ancillary systems that you're going to be getting data from. When we work with clients, we find that they start off with one or two, but the list of systems that need to be integrated goes up very quickly to double digits. So, when you're talking about so many systems that you need to integrate from, that is something unique that you'll see in healthcare. The second issue is about healthcare as a vertical. There's inconsistent data representation standards. Now, things are getting better, and I'll talk about specific data representation standards in healthcare that are now being widely adopted. But overall, data representation is not that consistent in healthcare. So when you're doing any sort of warehousing, you run up against this issue of how do you land and represent the data that you're bringing in from multiple systems. There's also a lack of interoperability between various systems. So, even between, let's say, EMRs, there's a lack of interoperability. So if your organization is using more than one electronic medical record system, you're going to have a problem in integrating data from them, right? When you're talking about non-healthcare systems, the problem becomes more severe. And then you have multiple use cases in healthcare for utilizing both streaming as well as batch data. So unless you land and make the data available in an effective manner, you're not going to be able to utilize the data for all of those use cases that your organization needs addressed. Now, when we work with clients, we find that there are three main stages of where an organization, a healthcare organization, usually is when it comes to any sort of warehouse or OLAP platform. By the way, the term OLAP is online analytic processing, which means some sort of a warehouse or analytic platform, which is as distinct from OLTP systems, which are online transactional processing systems, which is your production systems, which are used for various purposes, and OLTP systems can include things like your EMR systems and your ERP systems, CRM systems, revenue cycle systems, etc. So the three main stages, the stage one is where you have not thought of a data warehouse at all. And so all of your data is fragmented. It is in multiple databases, data stores, and all of these are pretty much mapped to the individual OLTP systems that are generating the data, right? So reporting and analytics is delivered in silos at this point because it's really difficult to integrate and merge data from more than one OLTP system. The second stage is this, where you have some sort of an old school relational data warehouse and maybe even an operational data store. And you're utilizing the warehouse in order to deliver analytics. Now, you have latency problems usually because your warehouse is most likely loaded maybe once a week, sometimes only just once a month. So any reporting and analytics you're delivering is not going to be using the most current data that has been generated in your OLTP system. The third stage is the most advanced, where you have either something called a data lake along with a warehouse. So the data lake pretty much accepts real-time or near real-time streaming data, which is just dumped into that lake. And then it's cleaned up and ETL'd, which I'll explain what that means, into a warehouse. And both are available for delivering analytics and other processes. The lake house is a further refinement of the data lake and data warehouse concept. And I'll talk about a data lake house tomorrow. Okay, so I talked about the multiple use cases in healthcare. And actually, that is the first step when you're looking to implement a warehouse. Instead of working forward from either the technology or working forward from the data itself, the best thing for a healthcare organization to do is work backwards from the business and operational use cases that you've identified. And most organizations may not have all of these use cases identified as being relevant to them when they are first implementing a warehouse. And there might be a few organizations, though, that have many more in addition to this list that I've just put in front of you. But the reason why working backwards is really a good strategy for your warehousing efforts is because it makes it makes sure that your warehousing is right sized, right? So you know then which types of data are going to be most critical to bring in first. You also know which business processes to transition over to the warehouse over, let's say, a 12 to 18-month period. Because when you implement the warehouse, there might be operational reports and analytics that are being generated directly from, let's say, an OLTP system, which you want to move to the warehouse. So when you understand what the full list of business use cases you're trying to address is, you can develop a plan to transition all of those operational reports, analytics, and other insight generating mechanisms over to your warehouse. So that's the first learning for this boot camp. When you're doing healthcare data warehousing, work backwards by first identifying the business and operational use cases you're trying to implement. Now, the second thing you need to do is do an inventory of your healthcare data. And here is not a fully exhaustive list of types of healthcare data, but the two most important types of healthcare data that most healthcare organizations have to deal with are, number one, clinical data from EMRs. So, especially if you're a provider, a hospital system or a physician group, you have a huge amount of data being generated through patient care operations, and most of that data is in your EMR, right? The second type of healthcare data that is very important is medical and pharmacy claims, which is healthcare claims as a whole. They're usually generated as part of the process of submitting bills for payment to health insurance plans, right? So providers submit claims or bills for payment to health insurance plans, and health insurance plans or payers pay those claims. Then the third type of data that is usually existing in most healthcare organizations is some level of care management data. That is, utilization management and case management, disease management data that has been generated through all those activities that have been carried out in that realm. Some organizations have omics data, which is, genomics and proteomics data, where you're having actual gene sequencing or other protein sequencing information about patients and members. It's not that common. But what is becoming more common is this fifth category, which is social determinants of health and other related data from external sources, external to your healthcare organization. So, as I said, this is not an exhaustive list of the types of healthcare data, but this is the second thing that you have to do when you set out on a warehousing journey, that after identifying the business use cases, the second thing you do is you do an inventory of the types of healthcare data that you're going to be managing or integrating into your warehouse platform. Okay. We come to, if you remember, one of the things I said is that there's a lack of consistency in the representation of healthcare data when you're talking about data from EMRs or from, claims, etc. So that's the other very important thing that you have to take care of when you are integrating data into some sort of a healthcare data platform. You have to absolutely decide on how you're going to represent and store your healthcare data in some appropriate data model. Right? For EMR or clinical data and healthcare claims data, we recommend using one of these models. So for clinical data, there's a new, it's not new, I mean, it's about 8 to 10 years old, but it's been getting wide adoption over the last 3 to 4 years. It's called FHIR, pronounced FHIR. So it's Fast Healthcare Interoperability Resources. So FHIR is a standard that is used to represent clinical data in all its richness. And so when you're undertaking a warehousing effort that involves EMR or clinical data, it is a good idea to store all your data in a FHIR derived or FHIR compliant data model. And we do this for our clients and with good success, because it does make it easier to integrate data from various EMRs, many of whom represent the clinical data in their own way, right? So this is a widely accepted and adopted data model. And then when you're moving all of your data in to represent it as FHIR, becomes easy to interpret. But based on your other use cases, especially if you are having a lot of research focused use cases, you might need to transform and represent the data into other data models as well. And so there are some research focused data models like I2B2 or OMOP that are also very popular. Now, I would not say that you should directly store your clinical data as I2B2 and OMOP, because these are very research focused data models. So the right thing to do here would be to first move your data into a FHIR-based data model and then derive the I2B2 or OMOP and other research focused data models or data models focused on other domains from the FHIR data model. For healthcare claims data, the FHIR model is available, but it's not as good. So what we've been recommending is there's an all-payer claims database model which organizations can adopt that can effectively store healthcare claims data in some sort of common format or specification. The APCD efforts are state-level efforts where the states expect payers in the region to submit healthcare claims data to the state governments. And so, but there's been a lot of standardization in these efforts, and there's data models derived from all of these state-level efforts that are now pretty consistent in how they represent the claims data. So for the two most important types of data that you're going to be encountering, clinical and claims, we recommend using appropriate schemas and data models. We're now going to go through some specific best practices around how you go about warehousing all of this healthcare data that you're going to be accommodating in your data platform. in terms of uh, ETL, low latency, direct support for machine learning and AI, uh, obviously total cost of ownership, master data management, and entity resolution. So I'm going to go through these one by one. The first is, uh, you know, there's the concept of ETL, and then there's ELT. So what's the difference between the two? Well, it's just order to some extent, right? So ETL is the old way in which data was moved into a healthcare data warehouse. So you would extract the data from your source system, your OLTP system. You would transform it in some way to make it better to work with in terms of analytics, and then load it into whatever traditional relational data warehouse product you've been implementing, right? So ETL, standard process, you've got these ETL jobs are usually run using ETL tools. So there's a whole lot of ETL tools available, whether it's Informatica, and then there's open source ones like Talend, and many others. So that's the traditional extract, transform, and load process. With the rising popularity of data lakes, where data is landed as is from the source systems without transformation, the process that became or has become very popular is called ELT. So as the acronym implies, it involves extracting the data from the source system and directly loading it into some sort of data lake. The transformation, on the other hand, is done later when it's loaded into the final relational or data mart structure. But what does an ALT process does is that it allows the data to be used or usable with low latency directly from the lake, right? So there's no week or month level latency waiting for the warehouse and the marts and the cubes to be loaded. Instead, data is directly usable from the data lake. It's dirty data, it's not that clean, but a lot of the use cases that require direct use of streaming or near real-time data are addressed through a data lake, and therefore, when you have a data lake in place, you don't do ETL, you do ELT. Correct architecture is crucial because I'm going to be describing at least about 4 architectures, but I'll do those, I'll go through those tomorrow in tomorrow's session. And then you have to identify the right processing tool set to do your ETL or ELT. So I did mention a bunch of tools like Informatica, Talend, etc. And then there are cloud-based tools that are provided by the popular cloud platforms, like Microsoft Azure has Azure Data Factory, and Amazon AWS has Glue. So those are for processing the ETL or the ELT. But in terms of the actual heavy lifting, with these big data platforms being used widely, the processing tools have also changed a lot. So the traditional tools are still available and popular, but other processing tools with much more power to process, especially streaming data or huge amounts of batch data, have become popular. So I've listed two of those there, Spark and then Kafka. And these are ETL tools that can be used for processing terabytes of data in both batch as well as streaming ways. And then the last thing, and as I said, I'll discuss what a lake house is in tomorrow's session. But if you are thinking of implementing a data lake with a traditional data warehouse, it might be useful to think of the next evolution of that concept, which is the lake house, right? Which brings the best of a data lake and a relational data warehouse, but in a packaged offering. Okay. In terms of the best practices that I listed, there's this concept called master data management. Now, what is master data itself, right? So master data is the core data around which your business exists. So it's the data that doesn't change that often. It's not the transactional data. It is the core data around which the transactions happen, right? So master data management involves the technology and all the processes that ensure that that master data is coordinated across the enterprise. In the healthcare domain, we've got 4 main master data domains, and they're listed there. And especially when we say customer, we mean either member or patient or provider, right? So when you've got the business of healthcare happening, you need to be very sure that you've got some sort of a single source of truth for your core data objects. And in the healthcare domain, that includes member or patient, provider, products, locations, and then there's an other category that's a catch-all. What master data management does is it's a set of technologies and tools and processes that make sure that your organization has a single source of truth, especially for your core data, not for all of the other data that might be generated, but for your core data domains. And that's important because most of your business involves these core data domains, as you would call these, the master data domains. And so master data management is required. Now, master data management intersects a bit with data governance, which I'm going to cover tomorrow. So in terms of best practices, this is the second one after effective ETL and ELT, which is you need to make sure you implement master data management in your organization as part of your warehousing efforts. The third best practice to follow, and this is very necessary for healthcare, is to make sure you have some sort of a deduplication or entity resolution process and technology in place, which is sometimes called an enterprise master patient index. Now, what is an enterprise master patient index? What it does is when you've got, let's say, you're taking care of patients and you're pulling data from multiple sources into your warehouse for those patients. There is a chance that you might be representing one entity or patient as two or three or four or many more if the data on those patients or members is being sourced from multiple systems. So, John Smith, uh, John Smith and Jon Smith, uh, whom you are maintaining as two separate entities right now, might actually be the same person. But you can't be sure without going through some sort of entity resolution process. You can't be sure on whether you should make the decision to merge those two entities. And that's why you need some sort of enterprise master patient index. If the same patient or member is represented in multiple streams and there's no real linking identifier, right? So it would be much simpler if, for example, you had something called, a national patient ID or something like that, which some other countries have, to link data on the same patients from multiple sources. But in the absence of that, you need some sort of a probabilistic mechanism to identify potential matches. And so the EMPI absolutely needs the right data models to support deduplication. And then you need to implement EMPI using a probabilistic algorithm that there are various products, both open source as well as proprietary, that you can use. So when we've done work for clients, we've used Splink a lot. There's also JED-AI and OpenEMPI, which are both open source. But there are also commercial EMPI offerings from vendors like IBM and Nextgate, etc. So it might seem that EMPI is something that you can deal with later after you've implemented your warehouse, but that's not really true, because effective EMPI entity resolution process has to be almost linked directly to your ETL or ELT. So that's something to make sure you're implementing as you think of your data integration and warehousing. This is something I'm going to cover tomorrow. This is, the right architecture for your healthcare data warehouse. There are at least 4 architectures that are, widely adopted in industry. There's no one best fit. An organization has to make the determination for itself on which architecture is appropriate for their needs. But that's where I'm going to stop today. And I'll continue tomorrow with the discussion of these architectures and with the other content that I described the outline of the course for. I'm going to take questions today on the material that I've covered so far. If you have a question, I would prefer that you raise your hand, or you can type the question directly into the chat panel. Any questions? I'm not seeing anything in the chat panel. Okay, one question came in directly to me through chat. So let me read this question out. Okay, so the user is asking, what is the right way to think about integrating data from claim systems into your warehouse? So I think it's a good question. It depends. I'm assuming that you're talking as a provider organization rather than a payer organization, because payers, for them, claims are the bread and butter. That's the first type of data that they're going to address putting into their warehouse. So I'm assuming this question is from someone who is at a provider organization, and for some reason they've got healthcare claims data being provided to them, maybe by the payer, and they're in charge of integrating it and then using it maybe for value-based care or other efforts. So the right way to do that, as I talked about during my presentation, you need to absolutely make sure you have the right data model to accommodate the claims data that you'll be getting, because you will be getting claims data, if you're a provider, from multiple payers, and all of them will not adhere to the same format for the file dump that you're provided. So it's upon you to make sure that you have the right ETL and ELT to transform the file dump of healthcare claims and load it into a data model that is consistent. As I said, for healthcare claims data, the APCD model, the all payer claims database model, is a good one to use because it is pretty consistent in how it represents claims. Okay, I've got another question here sent directly to me. I'm going to read it out. The question here is, okay. So they're asking about the three main stages of healthcare data platforms. So the question here is, how does the organization determine which stage it's at? Well, I think, if it all depends. I think if you analyze your own organization, you can ask some simple questions. Number one, do you have a warehouse? If you don't have any sort of warehouse at all, you're probably in stage number one, right? On the other hand, if you do have some sort of a warehouse, even if it doesn't accommodate all your data, even if it accommodates only one or two OLTP systems today, that means you're at stage two. And if you actually have a data lake, in addition to your relational data warehouse, then you're at stage three. So I think those three questions, do you have a warehouse? Do you have a data lake, and or do you have more than one system being integrated? Those three questions, if you answer for yourself, you will be able to figure out what stage your organization is in terms of the evolution of your healthcare data platform. Well, that was the end of the questions. So, thank you for joining us, and we'll continue tomorrow with the second part of this boot camp. Thank you.